Hey folks, I just want to talk to you about vitamin K, which is an essential fat-soluble vitamin, first discovered in the first half of the 20th century. It has a well-known role in helping your body form blood clots, which led it to be called anti-hemorrhagic factor. And interestingly enough, the name K, or the letter K, comes from the German or Danish word for coagulation, which starts with a K. And it may also be referred to as a set of structurally similar molecules that are active in our bodies, such as phylloquinone, phytonadione, and menaquinones. I don't know, I can't say them. Metabolically speaking, vitamin K is I said, fat-soluble vitamin, so it requires a functioning pancreas and biliary tree to adequately absorb through your gut. It is bound to proteins when you ingest it, and so the pancreas has proteins that help strip that off, and then it gets absorbed into your gut cells, attached to lipoproteins like chylomicrons, and then shipped off to various destinations. Its action, so its primary action it's an essential component of the coagulation cascade, which is part of the process that your body uses to stop bleeding and form blood clots. And this is normal and healthy part of how your body manages that. And it doesn't necessarily refer to deep vein thromboses or strokes or anything like that. It's also a cofactor for some proteins used in bone formation and certain glycoproteins. And it does share some relationship with management of bone mineral density, but that's not really well understood at this point. And its ability to prevent diseases of bone minerals, disease such as osteoporosis, osteoarthritis, etc., via supplementation is not well documented in the literature at this point. It does have some other potential benefits. It does appear to be neuroprotective, or maybe neuroprotective against Alzheimer's. It might reduce coronary artery calcification, although its impact on cardiovascular events and mortality is not well documented. Does appear to potentially, or may improve bone mineral density, reduce the risk of fractures, and oddly enough, and individuals who have had hepatocellular carcinoma, which is a type of liver cancer, have had that surgically removed, it might reduce the risk of recurrence in those individuals. Toxicity is exceptionally rare. The upper limit of vitamin K is not really well known. Clinical signs and symptoms of vitamin K deficiency include easy bruisability, mucosal bleeding, which is bleeding anywhere in your GI tract, splinter hemorrhages, which are clots under your nails, and blood in the stool and urine. Essentially what you develop is a dietary-induced or dietary-derived bleeding disorder. And they're rare. The deficiency is rare, and it's usually associated with diseases of the GI tract that cause malabsorption, such as cystic fibrosis or problems with your gallbladder or something like that. And it does also have some association with bone mineral density diseases like osteoarthritis, osteoporosis, hip fractures, and increased risk of cardiovascular disease. People who are deficient have those. And interestingly enough, it is also a common problem in newborns, and they all receive a shot of vitamin, or a dose of vitamin K shortly after delivery. And if it's not replaced, they're at risk of developing a vitamin K deficiency of the newborn, which is essentially that same bleeding disorder I just described a second ago. The reason for the deficiency is the liver enzymes just aren't up to task right when the baby comes out, and they don't use vitamin K very well. Sources are dark green or leafy vegetables, and that's why most people on Coumadin are supposed to be very attentive to their vegetable intake and salads and stuff like that. And it is also produced by intestinal gut bacteria to a certain extent. The recommended daily allowance in women is 90 micrograms, and in men 120, and that's roughly based upon a 0.75 to 1 micrograms per kilogram of body weight. And supplementation, however, is not generally necessary, as most people obtain enough from dietary sources unless they have problems with their GI tract, as I kind of mentioned before. So in conclusion, there's only a few things you really need to know about vitamin K. It's an essential fat-soluble protein. Its primary function in the body is to stop bleeding via the coagulation cascade. It does appear to have some other benefits, though, especially with diseases of bone mineral density and cardiovascular disease. Deficiency does result in an increased risk of bleeding, but is not an issue in most people. And the primary dietary sources are dark green and or leafy green vegetables.